Assessing passive range of the glenohumeral joint requires us to be disciplined about when we are accessing solely glenohumeral movement and when we are recruiting scapulothoracic motion. After all, most full ranges require movement in both joints. So if we look at, let's say, flexion, how far do we get in flexion before the scapula gets involved? We should be able to get 90 degrees of the humerus spinning on the glenoid fossa without the scapulothoracic joint getting involved. So how we do that is we take a hand, we place it along the top of the scapula, spine of the scapula, acromion process, and a thumb on the inferior angle. Then we passively reach into flexion, and we're feeling when the scapula recruits in the movement. And right about here, we feel, or I feel, the inferior angle moving away from the spine, so it's going into upward rotation, and we haven't quite got to 90 degrees. So that means that the glenohumeral joint is slightly limited in independent movement. As far as extension, it's really the same argument. Stephen, if you'd stand up, please. From neutral, from 0 degrees, if we go into hyperextension or extension, however you prefer, we immediately recruit the scapula into anterior tilt. So there's really no way to assess any pure extension in just the glenohumeral joint. So we're just looking for that 90 degrees of flexion without scapular compensation. Abduction is the same way. If we go into abduction, how far do we get before the scapula recruits? About 90 degrees. We should be able to get to that horizontal position without the scapula getting involved. And we do. We get about 90 degrees and the scapula really hasn't moved that much. If I continue to go up, I feel that I lose the inferior angle. Okay? So 90 degrees, no problem there with Stephen before the scapula got involved. So that leaves us, again, from 0, if you stand back up for me, Stephen, any position from neutral, obviously we can't go into adduction, we have to go into some flexion. And again, that's going to involve some protraction of the scapula or some opening of the anterior scapular joint. So there's really no farther than 0 degrees that we can go into adduction. And back seated, please. And that leaves us with rotation. We should be able to get a pretty clean read of rotation without scapular involvement. I like to bring my hip up and rest the humerus on my knee here, and that gives me a nice position for checking rotation. And what we're looking for is about 90 degrees of external rotation, 85 degrees of internal rotation. So from here, I'm going to go into external rotation. I'm feeling the scapula just for when that joint is coming to a stop. Okay, and we get almost to 90 degrees, not quite, but very, very close to 90 degrees in external rotation before we get a stop. Okay, coming back to neutral, now I'm going to drop down into internal rotation until we get stoppage. And we get almost to that 85 degrees, and we can see the joint starting to spin at the front a little bit. But again, we get about to that 85 degrees, no problem. So I'm pretty happy with his ability to rotate the humerus in the glenoid fossa. A little concerned about the internal rotation here, so maybe some tight external rotators in the glenohumeral joint there.